In these difficult and challenging times for Colorado, for America, for the world, where millions of people have died from COVID here in Colorado, over 8,500 people have lost their lives. Amidst all that challenge, amidst all the difficulty people have had, avoiding others and wearing masks and protecting one another, amidst all that, there's some great inspiration that we can draw. First of all, it's my hope that with this pandemic, we've inspired a whole new generation of people to go into healthcare and science, knowing the life-saving power that research and care and medicine can provide. But in addition, we had several hundred Colorado young people step up months ago, and raise their hands with their parents and say, you know what? I'm going to do my part to help end this pandemic, and I'm willing to be part of the vaccine trial for kids. And that's what we're celebrating today. The parents, many of whom are here, the kids who said, when I talk about the great pandemic of 2020 and 2021 with my kids, my grandkids, for decades to come, I want to be able to tell them with pride that I did my part to help end it. I raised my arm, I rolled up my sleeve, and I was part of the vaccine trial. And due to the success of that vaccine trial, the vaccine is now available to every 5 to 11-year-old here in Colorado and across the United States. And you did that. You did that. Because of you, I was able to get my 7-year-old and my 10-year-old vaccinated just this last weekend. And that wouldn't have been possible without your help. I've joined clinics at Children's Hospital and at the Denver Zoo, and to see the joy on the faces of the relieved parents and of the kids that know they'll be protected is such a great honor. And that honor is really a result of your being willing to do your part for science, for ending the pandemic. When the time came, you didn't hesitate, you rolled up your sleeve and you got it done. And already, with just really a week or so, less than a week of giving out the vaccine to 5 to 11-year-olds, 11,313 kids in Colorado are on their way to being protected. Our goal is to protect a majority, over 50% of kids by the end of January. And we're doing that with so many partners across the state, the Cheyenne Mountain Zoo, the Colorado Rockies, Dinosaur Ridge in Morrison, Children's Hospital. So many great partners, of course, through pediatricians and clinics across the state as well. And as Coloradans and as parents out there gain that sense of relief that their kids are protected from this deadly virus, I want to make sure we know who we owe that to. We owe it to the researchers, of course. We're going to hear from Dr. Simoes, who was the primary investigator at Children's Hospital. We owe it to the scientists who developed these life-saving drugs. And yes, we owe it to the kids and the families and the parents who volunteered to be part of the trial. On behalf of a grateful state of Colorado, we are here to say thank you. Things are tight in Colorado. In many areas of the state. We're experiencing a peak right now that many other areas of the country experienced a month or two ago. We're down to less than 100 emergency beds across our state. And there's still kids hospitalized from COVID, even as we speak. 25 kids in our state hospitalized for COVID. Now, that's very sad. The kids are hospitalized from COVID. But you know what's also very exciting? That thanks to your volunteering and others, we have a vaccine that is very close to, if not 100% effective at preventing hospitalizations for kids. Isn't that amazing? 100%. I wish it was that effective for people in their 60s and 70s and 80s. It's very effective, over 90%. But for kids, even more so. There's 17 kids, age 0 to 11, in the hospital right now from COVID. That number can be 0. There are 8 kids in the hospital between the ages of 12 and 17. And in many ways, this is even sadder because they don't have to be there. The vaccine has been available to them for months. 0 of those 8 kids between age 12 and 17 that are in the hospital were vaccinated. None of them were. They all were unvaccinated. They're all hospitalized. Many of them, I hope all of them will get better, but it's still grueling to go through days or weeks in the hospital, missing school, missing your friends, sometimes a long recovery to regain your health. And we've also lost over 8,500 of our friends, our neighbors, our loved ones. And before we hear from a few of the kids that we owe so much to, and we owe so much to the parents as well, I want to introduce someone who helped oversee the trial at Children's Hospital. Children's Hospital Colorado not only hosted the largest trial site in the country, but it's also partnering with the state of Colorado to get kids vaccinated in Aurora and Broomfield and Highlands Ranch and Colorado Springs. And we can be proud as Coloradans of our young people here who helped end the pandemic. We can also be proud that Colorado had more participants in this study per capita than any other state in the country. To speak more about the trial, but also just the overwhelming results of the trial and why every parent out there listening should immediately go and get their 5 to 11-year-old vaccinated, their 12 to 17-year-old vaccinated, themselves boosted, I'm happy to turn it over to Dr. Eric Simoes, the primary investigator for the Pfizer trial at Colorado Children's Hospital and co-director of the Maternal and Child Health Initiative. Dr. Simoes, please.
So, thank you, Governor Polis, for the opportunity to be here with you today with all of our children and family members and our team. I would like to thank the children and their families of the 252 children who participated in the trial in Colorado. Some of whom are here and some of whom didn't come. Together, your significant contributions are the reason that children ages 5 to 11 across Colorado, our nation and over the globe, are now eligible to get their vaccine. I have to thank our research team on this side and that side. I have to thank our senior management at Children's Hospital who made this happen. Without their support, this would not have happened. Let me tell you a little bit about the trial. Children's Hospital Colorado, as Governor Polis said, was one of the 81 sites that contributed to this study in 4 countries, the United States, Poland, Finland, and Spain. And we recruited overall 2,250 children. Of that, our site accounted for 252. More than 10% of the global total. You have to be proud of that. This was the largest site in Pfizer's worldwide COVID vaccine for trial in children 5 to 11. The trial began, as you all know, in summer, in June. There were 252 of our children. They actually were part of 5,000 children who applied. We had an overwhelming response. The trial was a double-blind randomized trial, which means neither we nor the participants knew whether they received the vaccine or the placebo till very recently. Children were vaccinated in a ratio of 2:1. Vaccine is to placebo. With the EUA and then the CDC allowing us to vaccinate these children, as you know, a lot of children have been vaccinated, we now have been able to unblind the children in this trial, and it has taken us a little while, and we thank you very much for your patience. Now we are vaccinating all of the recipients, the 1/3 of the 252 participants who received the placebo, to now get the full dose of the vaccine, that their colleagues and friends and your families helped contribute to and establish the dose that is being used in these children. As principal investigator of this site, and one of the largest sites in the world, I believe in the science and integrity of the trial and this vaccine. I also got to meet most of y'all. I recognize most of y'all, and I spent at either the first or the second vaccine dose, and all of your children. And I think it's a remarkable thing that the children and your families have contributed to. And I'm proud to stand amongst y'all and this major contribution to what is now a global phenomenon. Finally, a little bit about COVID. I do have to tell you about COVID in children. Fortunately, most children are not severely affected. We know that. However, with the Delta variant, which we have now, it's a different circumstance. Children's Hospital, from the beginning of the pandemic, had 2,000 children who were hospitalized. And Governor Polis told you the latest circumstances, the latest numbers that we have at the moment. While early in the pandemic, children and adolescents were not affected as much as adults. 5% of children, on the average, of all of the infections were in children under the age of 18. Now, as in October, because of the Delta variant, it's 25%, a much higher rate. Children 5 to 11, the target group for our study, occupy 50% of those infections. That's why it's so critical to vaccinate this age group. Finally, I have to tell you that the Delta variant spreads amongst children. The previous Alpha strain spread mostly from adults to children, but the Delta strain spreads through children, through schools, and into families. And we are seeing that. Families are being affected now from children bringing it home. The vaccine was almost 91% effective in preventing infections in children. It's quite amazing. There were no serious side effects, and it was quite safe. The safety was compared to adolescents, and it was as safe. 99% of the children in our trial had antibody responses that are protective, which is wonderful. As a doctor, researcher, and a father of young children, I encourage everyone who can be vaccinated to do so. Vaccines, for the most part, prevent severe COVID infections. However, I cannot emphasize more that vaccines alone are not enough to protect you. Please prevent yourselves from getting infections. And all of you who I've spoken to personally know that I really, even if you're vaccinated, would encourage you and your children to wear masks. It prevents the transmission of the virus, and it protects you from getting infected. It protects your children from getting infected, and it protects them from bringing the infection home and infecting older adults and our loved ones. The Delta variant is really highly contagious, and it spreads in families. Compared to the rest of the world, you are privileged to have access to COVID vaccines and the means and the measures to prevent the transmission of the virus. Please protect yourselves, your families, and your loved ones, and that is my plea to you. The COVID vaccine for children 5 to 11 is now available in large part thanks to these wonderful children who volunteered to be part of the trial. Their families and the children understood the importance of their contributions to science and the importance of the vaccine. I want to extend another thank you to all of the children and the families. You have been incredible to work with, and I thank you for your contribution to science, history, and humanity. Thank you all, and please stay healthy.
You know, there's different ways to be a hero and save lives. You could rescue somebody who's drowning. You could apply the Heimlich maneuver and rescue somebody who's choking. But for our kids here today and their families, I want all of you to know that you are heroes and that you saved lives. Lives of people you may never meet, you may never get to know, but there will be hundreds, even thousands of more Coloradans who get to go through life and be safe because of your heroism. Thank you to all of our kids and families. I also want to encourage my fellow Colorado parents. Don't let these kids' act of bravery and heroism be in vain. Take advantage of this highly effective vaccine to help protect your kid and your family and to help end this pandemic here in the state of Colorado. Thank you, Dr. Simoes. I also want to thank others at Children's who worked on the trial, Jenna Hausman, Michelle Lucero, Dr. Bajij, Janae Neiman, and really everybody on the team who worked to make this happen. We have two young people, two trial participants who are going to share their experience today and a message to their fellow kids and to parents across the state. I want to introduce first Uma Sriram, one of the trial participants who's joining us today. Uma?
Hello, my name is Uma Sriram, and I am in the 4th grade. I just wanted to say thank you, Governor Polis, for giving me the opportunity to speak about the vaccine trial. Getting the vaccine was important to me because I want to encourage others to get the vaccine and to keep my friends and family safe. I want to keep the ones I love safe, like my baby brother, since he can't get a vaccine yet. The vaccine didn't hurt very much. The vaccine only hurt for a teeny second, and after that, my arm ached a little. It was not painful, and I could still play and do other normal things. I'm glad I was in the trial because now other kids can also get the vaccine. I think kids should do it to protect the ones they love and keep themselves healthy, as well as keep our schools open. I feel very lucky to have been in the trial and gotten the vaccine. Thank you for giving me a chance to talk to everyone, Governor Polis, and thank you for helping keep kids safe.
You know, and another thing I want the kids and the families to know, whether your kid or whether you receive the placebo or the vaccine, you are just as big a part of this discovery that this works. The scientific process means that we need to compare a vaccine and a placebo to show what works. So you contributed just as much to making this available, whether it turned out that you got the placebo or the actual vaccine. So be proud either way, because you were part of science. I'd now like to introduce another one of our brave Colorado heroes who is willing to roll up his sleeve and help make this effective vaccine available to every other child in our state, Liam O'Byrne.
Oh yeah. Hello, my name is Liam. I am 10 years old and I live here in Colorado. Thank you. Earlier this year, my mom found out that there was a Pfizer COVID vaccine trial for kids 5 through 11 years old and asked me if I wanted to be a part of it. When she asked me this, I said yes, because at the time we had been in COVID for a little more than a year, and I wanted to be a part of it and try to help stop the spread of COVID. I had my first shot on June 10th, and 3 weeks later I had my second shot. Afterward, I kept a log to help researchers understand any side effects I might have. The effects of the shot were slight chills, headache, and fatigue. My symptoms lasted for a day and a half. I recently found out that I received the vaccine and not the placebo. Today I feel great, and I am happy I was able to help. I would like to thank Governor Polis, Pfizer, and Children's Hospital Colorado for giving me the opportunity to participate in this trial and speak today. The vaccine is the best way we can help stop the spread of the virus and protect people who are most vulnerable. Thank you.
Thank you, Liam. I have a special song for you here. Thank you. And as a token of the great gratitude of the state of Colorado, we've presented each child with a certificate of gratitude from all of us in Colorado, parents in Colorado, but also everyone who wants to see this pandemic end. We've also provided each of you with a special State of Colorado pin. If you haven't received one yet, please come get one after we conclude this ceremony. On behalf of the entire state of Colorado, I want to say thank you to the kids and to the parents who stepped up to save lives and end the pandemic. And to other parents across the state, I want to make sure that you take advantage and of this great knowledge that we've gained of the heroism of these kids and use this knowledge that we now have a safe and effective vaccine to protect your own kids and protect your own family, to help save lives, to help reduce hospitalizations, and to end the pandemic. On behalf of a grateful state of Colorado, thank you. Does anybody raise your hand if you still need a pin?